Lung cancer screening is a test that we do to detect presence of lung cancer. Especially we do it among patients who do not have any symptom. So it's like a health checkup, but it's a check or test that is dedicated to detect lung cancer. It is important to detect lung cancer at an early stage because usually at an early stage we can still treat, we can still remove the cancer, and afterwards the patient can still resume their normal life. So lung cancer screening can detect up to 80% of lung cancer at an early stage. And usually we do a test that we call low-dose CT, which is a form of test that works like an X-ray, but it will be able to show a more detailed picture on your lung image. Hence, we can detect whether any presence of cancer or not, and if there is a cancer presence at an early stage that can benefit from surgery, then we can do the surgery as soon as possible.
There are a few criteria for people who need to do this lung cancer screening. Number 1, age between 50 to 80 years old. Number 2, smoker or ex-smoker, at least for the past 15 to 20 years. And then number 3, smoker who at least smoke 20 pack years. 20 pack years means this person have been smoking 20 years, 1 pack a day for 20 years. So how to calculate pack years is that you calculate the number of pack of cigarette that you've been smoking times the number of years you've been smoking. So let's say you are smoking 1 pack per day for the past 20 years, so you have been smoking for about 20 pack years. If let's say you smoke half pack per day for about 20 years, means that you are a smoker of 10 pack years. So basically these are the 3 criteria that fulfill the requirement to do the lung cancer screening test. So talk to your doctor, see whether you can do your lung cancer screening test if you fulfill these 3 criteria. 50 to 80 years old, age, smoker or ex-smoker for the past 15 to 20 years, and 20 pack years of smoking history.
You just have to be healthy, means that you have to make sure that you do not have any cough or any fever or any difficulty breathing or any form of lung infection. So basically you need to be healthy to do this lung cancer screening test. If let's say you are having some sort of lung infection, then you might want to delay your lung cancer screening test. So you talk to your doctor, see whether you qualified for the lung cancer screening test or not. During the day, we will ask you to wear a gown, remove your jewelry, and just lie on the CT scan board. And then after about 15 to 20 minutes, the CT scan will be over, and then you will know your results, the diagnosis, the findings of your lung cancer screening, within about 1 to 2 hours, after the report has been analyzed by the radiologist in charge. So basically, make sure you are healthy, do not have any lung infection, fever, cough, shortness of breath, and you can do the test within 15 to 20 minutes, and the results will be out within 1 to 2 hours. What to do if you have positive results from the lung cancer screening? The next step after the scan is that we need to do a biopsy. A biopsy means that we need to decide what is the type of lung cancer that you're having, because lung cancer have many types. Each different type of lung cancer will require different type of treatment. So you need to identify by doing the biopsy. Biopsy is when you put in a small needle into the nodule, then you can see you can take the tissue out from the lung, then you can send it to the microscope, then you see what type of lung cancer it is. Afterwards, you will need a PET scan. PET scan is when you do a scan involving your whole body, your brain, your lungs, your stomach, your lower part. So basically, when you do a PET CT, you can see whether your lung cancer has it spread to other area or it's just confined to the lung. So those are the things that you need to do once you are found to be positive for your lung cancer screening test. What are the risks of doing this lung cancer screening test? Basically, this is a very safe test. It involves very small amount of radiation. That's why it is called a low-dose CT, because compared to normal CT scan, low-dose CT only exposes you to a low amount of radiation, so it's actually a safe test. If you are at high to develop lung cancer, then it is safe for you to do the test on a yearly basis until you are asked to stop it. False positive means that the test might be able to detect a nodule that looks like a lung cancer, but it's actually not lung cancer. It is something non-cancerous. So this is when you need to discuss further with your healthcare provider, with your doctor, to really check whether this lung nodule or this white patch, is it cancerous or not. There are a few characteristics that can differentiate whether the finding is actually cancerous or non-cancerous. also a risk of finding other things apart from lung cancer. We call it incidental findings. Yeah? For example, you can also find there is some lung fibrosis. Fibrosis means scarring of the lungs. Yeah? Scarring that can happen due to previous exposure to dust or occupational hazards and things like that. When you weigh the risk and the benefit, definitely the benefit is more than the risk. The benefit is that you can detect the cancer at an early stage, and when you detect it at an early stage, then you can remove it, and afterwards you can lead a normal life.